Hey there! Today, we're getting into something that's equal parts art and hardcore engineering, and it's absolutely critical to surgical success: periodontal suturing. Yeah, it might look like a simple stitch, but believe me, there is a whole world of science packed into that tiny little thread. Let's get into it. So just think about it for a second. After a really complex procedure inside the mouth, what's the one thing that holds it all together? The thing that kicks off the healing and protects all that delicate work that was just done? It's the suture. It's the first, and you could argue, the most important line of defense. So here's our roadmap. We're going to walk through how a surgeon thinks, starting with the main goals of suturing, then the big debate over materials, choosing the right needle, and finally, the techniques that really create the perfect environment for healing. First up, let's talk about what we're actually trying to do here, because suturing is so much more than just closing a gap. It's really about taking control of that entire post-op phase. Okay, so here's the mission broken down into 5 key goals. First, you've got hemostasis. That's just a fancy way of saying stop the bleeding. Next, you want to get healing by primary intention, which is all about lining up those tissue edges perfectly so they can heal cleanly. Of course, sutures help reduce pain. They hold the gum tissue, the flap, exactly where it needs to be, and super important, they prevent bone from being exposed, which helps you heal way faster. All right, so a surgeon knows the goals. Now comes the first big decision: what material to use. And this is nothing like picking thread at a craft store, let me tell you. This choice has major consequences for how well you heal and whether you get an infection. Sutures basically come in 2 main flavors. On one side, you've got monofilament. It's a single, smooth strand. It just glides right through tissue with almost no friction. And because it's so smooth, bacteria can't really get a grip on it. But on the other side, you've got multifilament, or braided sutures. Think of a tiny little rope. That braided texture is great for tying knots, but it creates a huge problem. It can wick bacteria along its strands. It literally becomes a bacterial superhighway, funneling germs from the mouth straight into the wound. And look, this isn't some new idea. This quote from way back in 1974 really drives the point home. We've known for decades that the suture itself is often ground zero for infection. So, yeah, the choice of material is directly tied to patient safety. Now, materials are also grouped in other ways, right? Like, do they dissolve on their own, or do they have to be removed? And are they natural or synthetic? And this is where you can actually see science in action. Natural, absorbable sutures used to be common, but we found out they can cause a lot of inflammation. So the field has pretty much moved on to way better synthetic options. So we've picked our thread, but what about the thing that actually delivers it? The needle is just as important. I mean, you wouldn't use a sledgehammer to fix a watch, right? Same idea here. You can't use the wrong needle for delicate periodontal surgery. Just look at all these different shapes. Each one of those curves is a specialized tool. A gentler curve might be perfect for an area that's easy to get to, but that really sharp half-circle curve, that lets a surgeon get in and work with incredible precision in those tight, hard-to-reach corners at the back of the mouth. And it's not just the curve, it's the length too. This table shows the logic perfectly. For the smaller, more delicate work you have to do at the front of the mouth, a shorter 10 to 12 millimeter needle is perfect. But for the molar area, where you just need more reach, you grab a longer 13 to 15 millimeter needle. It's just about having the right tool for the job. Okay, we've got our materials, we've got our tools. Now let's talk about the actual skill, the technique. How are these things actually used to bring the tissue together and lock it down for healing? This is a classic, one of the most common techniques, the interrupted interdental suture. Let's walk through it. First, the needle goes through the outer gum tissue on the cheek side. Second, it crosses over that little space between the teeth. Third, it passes through the inner flap on the tongue side. And finally, you tie the 2 ends together. Boom! One single secure stitch. And that last step, the knot, that's the anchor for this whole system. Seriously, all that careful choice of material and needle means absolutely nothing if the knot gives out. A well-tied square knot gives you fantastic security. It makes sure that suture holds its tension and lets the tissue heal exactly where you want it. Every little detail matters. So let's pull all these threads together now. Why do all these choices, the material, the needle, the technique, why do they matter so much? Well, it all comes down to one thing: controlling the environment where healing has to happen and winning that battle against bacteria. Here it is, the fundamental challenge of any oral surgery. The mouth is, by its very nature, warm It's moist, and it is absolutely teeming with bacteria. It's an incredibly tough environment to try and heal a fresh surgical wound. And this brings us right back to that suture showdown. In an environment like the mouth, a braided, multi-filament suture isn't just a piece of thread, it's a magnet for contamination. It becomes that bacterial superhighway we talked about, giving infection a direct, paved route deep into the healing tissue. So, the solution, the main takeaway here, is pretty clear. To give the patient the absolute best shot at a fast, clean, infection-free recovery, the go-to choice is a monofilament suture. Its smooth surface just doesn't give bacteria a place to hide, and that tips the scales in favor of predictable healing. When you really stop and think about it, it's pretty amazing. It's just a simple thread, but it represents a whole universe of material science, of engineering, and microbiology. It kind of makes you wonder, what other everyday tool in your life is hiding that same level of mind-blowing complexity?
You know, when you think of a needle, what comes to mind? Probably something super simple, right? A sharp point and a thin piece of metal. But what if I told you that the tiny surgical needle in a surgeon's hand is actually one of the most high-tech, precisely engineered tools in all of modern medicine? Today, we're going to pull back the curtain on this incredible, life-saving marvel.
All right, so let's get right into it. We're going to tackle this one big question. What exactly transforms this seemingly simple object into a high-tech instrument? The answer? Well, it's pretty incredible. It's this whole symphony of design choices where every single one is absolutely critical for a successful surgery and, of course, for a patient's healing.
So to really get this, we've got to start with its most basic purpose. It's not just about, poking a hole. It's about creating a pathway with incredible intention and care.
And this is the key phrase right here, minimal trauma. Literally every single aspect of a surgical needle's design is obsessed with that one goal. It's all about passing through the body as gently as humanly possible, leaving a clean path for that suture to follow. That's what gives the tissue the best possible chance to heal perfectly.
Okay, so how do they actually pull this off? Let's break the needle down into its core parts. Think of it like popping the hood on a Formula One car. Every single component has a very specific, very high-stakes job to do.
We're going to look at three main parts. The point, which does the actual piercing, the body, which is what the surgeon holds onto, and the eye, which holds the thread. So let's take a look at each one. All right, first up is the point, the tip. This is, the business end. And what's wild is that it's not just sharp. The geometry of this tip is custom engineered to pierce everything from the most delicate blood vessels to really tough skin, and to do it effortlessly. Okay, next up, the body. This is the grasping area, the needle's handle really. Now, here's what's so clever. It's often flattened. So why do that? It's all about control. A perfectly round body could easily twist or roll in the surgeon's needle holder, but a flattened body acts just like the head of a wrench. It gives the surgeon complete, rock-solid rotational control with every tiny movement.
And finally, we've got the eye, or in modern needles what they call the swage. And this is a total game changer. You know how with a regular sewing needle, you loop the thread through the hole? That creates this bulky lump that you have to drag through the tissue. With a swage needle, the suture is fused right into the metal end, creating one single, smooth diameter. It's a brilliant design that goes right back to that core principle of minimal trauma.
Okay, so we've got the basic anatomy down. Now let's talk about the first big design decision, the shape. It might not seem like a big deal, but the curve of a needle is a critical piece of engineering.
I mean, sure, straight needles have their uses, usually on the surface, where a surgeon can just push them straight through. But the real genius is in the curve. A curved needle lets a surgeon work in a really tight, confined space with just a simple twist of the wrist. It's an amazing bit of ergonomics that turns a simple push into this perfect, precise arc.
And get this, not all curves are the same. Needles are actually classified by how much of a full circle they make up. A 1/4 circle is just a slight bend, but then you get all the way to a 5/8 circle and that thing is seriously curved, designed to get into the absolute tightest spots deep inside the body. It's like having a whole set of specialized tools for different jobs.
So how does a surgeon actually pick the right one? Well, let's look at a really specific example. In periodontal microsurgery, that's super precise surgery on your gums, the 3/8 circle needle is often the go-to. And why is that? Because it hits this perfect sweet spot. It's got enough curve to get around things, but it's not so curved that it gets awkward to handle. It is literally the right tool for that exact job.
So shape is one huge factor. The next one is even cooler, I think. It's the design of the tip itself.
And this is where the microengineering gets really, really clever.
So you can basically break them down into two main types. You've got tapered points, which are kind of like a smooth cone. They gently spread the tissue apart, so they're perfect for delicate stuff that's easy to pierce. But for something tough, like skin, you need more bite. And that's where cutting points come in. They have sharp edges, almost like a tiny scalpel, designed to slice their way through. And this is where the engineering gets really smart. Check out the reverse cutting needle. Instead of putting the cutting edge on the inside of the curve, they put it on the outside. It seems like a tiny change, right? But the impact is huge. It means the flat, strong part of the needle faces the wound edge. And what that does is drastically reduce the chance that the suture will tear right back through the tissue when the surgeon tightens it. It's just an incredibly smart design that leads to a much stronger stitch.
Okay, now just look at this. On the left, you see a perfect, brand new needle tip under a microscope. And on the right, that's what happens after it bumps into a hard surface just once. That tiny bit of damage, that blunted tip, can cause tearing and all sorts of unnecessary trauma. It's just an incredible illustration of how fragile this precision is and why these instruments are handled with such amazing care.
All right, so let's put all these pieces together. How does a surgeon actually combine all these things? The shape, the size, the tip, for a specific procedure. Let's go back to that periodontal microsurgery example.
And here's the thing to remember. None of this is random. A surgeon doesn't just reach for a needle. They pick a very specific tool based on a precise calculation of what they need to do, where they're doing it, and exactly what kind of tissue they're working with.
And this table just lays it out perfectly. So look here. For these small incisions on the cheek side of the gums, you need a tiny little 5 to 8 millimeter needle. But for stitching between the front teeth, you need a longer one, 10 to 12 millimeters. And for reaching all the way in the back by the molars, even longer. But notice, they're all that same 3/8 circle with a cutting tip, the perfect combination for that specific environment. Every choice is deliberate.
So, when you bring it all together, what do you get? You get a masterpiece of engineering. Every single part is designed for minimal trauma. That seamless swaged eye makes for a smoother passage. The shape is perfectly matched to the space the surgeon is working in, and the tip is tailor-made for the tissue it has to go through. It really is a marvel of microengineering. And that just leaves you with one final thought, right? It makes you wonder, what other everyday things that we see all the time are we just totally taking for granted that are hiding this same level of incredible, life-saving design just waiting for us to notice?
Let's talk about surgery for a second. What's the first tool you think of? Probably a scalpel, right? But what about the thread that puts everything back together? It might look simple, but a surgical suture is actually a seriously engineered piece of medical tech. And choosing the right one? Well, that's one of the most critical calls a surgeon has to make. Let's get into it. So here's the fundamental problem, the big paradox. Every single suture is a foreign object. And when you place it inside the human body, especially somewhere like the mouth, which is just full of bacteria, it can cause inflammation. It can even become a literal highway for infection to travel into a wound. It's a real tightrope walk for the surgeon, trying to close a wound without accidentally creating a whole new problem. So to really understand how this all works, we're going to walk through the key decisions a surgeon faces. Is the thread made of one strand, or is it braided from many? Is it going to dissolve on its own, or does it need to be removed? And here's a weird one. When is a thinner thread actually safer? And then we'll cap it off by looking at what's next for this incredible technology. Okay, so the heart of the issue is this. An incision is an open door for infection. And the suture material you leave behind in that wound can either be a helpful gatekeeper, or it can prop the door wide open. In fact, most wound infections actually start right around the suture material itself. So the choice of thread directly impacts how well a patient recovers. The first big choice comes down to the physical construction of the thread. Is it going to be one single solid strand, or is it going to be a bunch of strands all woven together? This one choice has huge consequences for how bacteria can interact with the suture. On one side, you have monofilament sutures. You can just think of a single piece of fishing line. It's super smooth, so it's really hard for bacteria to get a grip. On the other side, you've got multifilament sutures, which are braided like a tiny little rope. Now, surgeons sometimes like them because they handle well and they tie great knots, but that braided design comes with a really dangerous hidden risk. And this is the risk we're talking about. It's a phenomenon called the wicking effect. Because that multifilament suture is made of all these tiny little threads, the spaces between them act like a candle wick. They can literally suck up fluids and all the bacteria in them, from the outside world and pull them right down the thread, deep into the healing wound. Now, here's where it gets really bad. It's not just that bacteria can travel along the suture, they can get inside the braid, into those little nooks and crannies. And once they're in there, they're completely shielded from the body's immune cells. It's like a perfect little hideout where they can multiply, totally safe from your body's defenses. All right, so after a surgeon picks the structure, the next huge decision is about the material itself. Is this thing designed to stay in the body forever, or will it just dissolve over time? This is basically the difference between stitches that you have to get removed and the ones that just kind of disappear on their own. This chart breaks it all down pretty clearly. You've got two main buckets, absorbable and non-absorbable. And inside each of those, you have natural materials, think silk or animal gut, and then modern synthetic ones, like polygalactin or nylon. And just look at the key characteristics. The natural stuff is almost always a problem. It either causes a ton of inflammation or it's famous for that wicking effect. The real advances have all been in the synthetics. Let's just talk about the old school way for a second. The very first dissolvable stitches were made from the intestines of animals, like sheep. Your body breaks them down with enzymes, basically digesting them. The problem is that process triggers a really strong inflammatory reaction, which is why, for the most part, that stuff is completely obsolete today. Now compare that to the modern stuff. Synthetic absorbable sutures are so much smarter. They break down through a simple, clean chemical reaction with water called hydrolysis. It's a way more predictable process, and crucially, it causes way less inflammation. It's just a much safer, cleaner way to go. All right, so for our last big decision, we're talking about the thickness of the thread itself. And this is where things get really fascinating, because it's completely counterintuitive. You'd think for surgery, stronger is always better, right? But for delicate tissue, that's often the exact opposite of what you want. First, you just have to get your head around their completely backwards sizing system. A suture labeled 7/0, that's 7/0, is way, way thinner than a 3/0. So the bigger the number in front of the 0, the finer the thread is. Your standard surgery might use a 3/0 or 4/0, but for microsurgery, you're talking 5/0, 6/0, all the way up to 9/0, which is barely visible to the naked eye. And just look at this. This is exactly what we're talking about. These are incredibly fine threads holding together super delicate gum tissue. This kind of work is literally impossible without a microscope and a surgeon with an impossibly steady hand. So this brings us to the big question. If you're trying to stitch together tissue this fragile, wouldn't you want the absolute strongest, toughest thread you could find to make sure it holds? I mean, it seems perfectly logical, but a fascinating experiment showed us something else entirely. So researchers started pulling on sutures in delicate tissue to see what would happen. When they used a thick, strong 3/0 suture, the thread itself held up just fine. But at about 13.4 newtons of force, the patient's tissue just ripped apart. The suture was actually too strong for the very thing it was supposed to be holding. But now watch this. They did the same test with a superfine 7/0 suture. At a much, much lower force, only 3.6 newtons, the suture itself broke. It snapped clean, long before it could do any damage to that fragile tissue. And that is the whole point. The finer suture acts like a little mechanical safety fuse. A surgeon will intentionally pick a thread that's just strong enough to hold the tissue together under normal tension, but weak enough so that if something goes wrong, if there's too much swelling or a sudden movement, the suture will fail first. It's a built-in safety feature designed to protect the patient's own body. So as you can see, these sutures are so much more than simple thread. They are highly engineered tools, and the technology is always evolving. We're moving away from sutures that are just passively sitting there to ones that can actually play an active role in healing. And a perfect example of this is the antibacterial suture. Companies are now coating dissolvable sutures with a substance called triclosan, and this coating actively fights off bacteria. It messes with their cell membranes and stops them from growing along that suture line for almost a week after surgery. So the suture isn't just closing a wound anymore, it's actively defending it. So when you pull it all together, you realize a simple stitch is anything but. The choice of monofilament over multifilament, synthetic over natural, a fine gauge over a thick one. These are all incredibly deliberate, science-backed decisions. It's all about matching a highly engineered tool to a very specific biological challenge. Which, of course, leaves us with one final thought. We've gone from animal gut to advanced polymers, and now to sutures that literally fight infection. If we can make a simple thread this smart, what's next? Sutures that release growth hormones to speed up healing, maybe ones that can sense an infection and change color to warn us. The future of closing a wound is probably going to be even more amazing.